Welcome to Terrigal Medical Centre. Just thought we'd walk you through our practice as to what we're doing. Today is Thursday the 26th of March, and as we know, day by day everything is changing. But what we did in the last couple of weeks, we've set up our practice to make sure that we reduce foot traffic through our practice, and most of our doctors have gone to telehealth as much as possible for our vulnerable patients. We're doing a lot of phone triaging, and we've actually set up 2 tents in our practice, which are in 2 car parks. We're very lucky we have a front and back access to our practice. And we've had a tent at the front where we do a phone triage to that from either nursing or medical staff into that tent, and that's for ERTIs, for any fever, and perhaps for people who don't fit the criteria for swabbing, although today we've just actually had increased criteria. And then we're actually also triaging by medical triage, so a telehealth with one of the doctors to actually work out those patients who require swabbing. So unfortunately, to say we have turned up 3 positive swabs that we know of to date within our practice with our swabbing, and we are donning our PPE. Unfortunately, we actually only have around about 8 to 9 full-length gowns left. So there's a plea to the government, to whoever we need, that we in general practice are going to be doing a lot of this work, and we need this equipment. We have set up our little area here, which is just a clean area, but it assists us in being able to don our gear. At the moment, most of our patients are getting triaged by phone to stay at home and to let us know if anything deteriorates. And then day by day, we may be swabbing more people, but we're running out of swabs. We've got plenty of gloves at the moment, but certainly our masks are difficult to get. PHN have been terrific, but they're reducing as well. We've triaged via telehealth, so we know who's coming. We've given them a time. They're parked out the back in their car. Usually we're swabbing either from their car or just into the doorway of the tent, just for some privacy. And there have been some febrile people, so I've been listening to their chests and taking their temperatures, avoiding very much. We've now told don't look in throats, try very carefully to make sure when we do the swabs that the person is well away from us as we swab their throat and the nasopharynx. So in general practice, we're doing 1 swab, and it's going down to the oropharynx and then up into the nostrils, probably into the nasopharynx if you can, and then that's going away. We are trying to prioritise our healthcare workers, so we have had a number of those who have become symptomatic with a lot of ERTI symptoms, and we're certainly seeing the overseas travellers in the last 14 days who are in self-isolation. All of our patients have told us they're in self-isolation, but as they become symptomatic, we've been swabbing them. Our staff are our priority, as well as the other doctors in our practice, and our staff know what we're doing. They've been, as understandably, quite anxious, and we're trying to work very hard with trying to appease their anxiety. All the doctors have now gone into telehealth. You've probably noticed in the waiting room, very few people are coming actually into our practice. So good luck, general practice.